In critical care, nurse practitioners in India are taking on more responsibilities, from patient management to complex decision-making. This evolution is vital for the healthcare system. Over the past decade, the number of nurse practitioners has increased by 30%, reflecting their growing importance. Specific examples include their roles in managing ICU units and leading patient care initiatives. However, it brings challenges like the need for advanced training, better support systems, and recognition of their expanded roles. Professionalism in India's ICUs is more than just following protocols. It's about adapting to unique challenges, understanding cultural nuances, and providing compassionate care. Nurses must blend technical skills with emotional intelligence to navigate patient care complexities. For instance, a nurse might need to explain a critical procedure to a family with limited medical knowledge, ensuring they feel supported and informed. Or they might have to manage their own stress while delivering high-quality care in a high-pressure environment. Professionalism also means continuous learning and adapting to new medical advancements to provide the best care possible. Challenge 1. Role recognition. Nurse practitioners in India fight for recognition. Despite advanced skills, they're seen as assistants, not autonomous clinicians.
We have the training and expertise to make critical decisions, but often our role is misunderstood, says Priya, a nurse practitioner from Mumbai.
Recognition is crucial for us to provide the best care possible, adds Raj, another nurse practitioner. Without it, our potential is limited. These challenges highlight the need for systemic changes to acknowledge the critical role nurse practitioners play in healthcare. Challenge 2. No legal framework. The absence of clear laws or a licensing authority blurs professional boundaries, significantly affecting daily operations and decision-making power. For instance, nurses often face uncertainty about their scope of practice, leading to hesitation in critical situations. Additionally, without standardized guidelines, there is inconsistency in patient care protocols, which can compromise patient safety and outcomes. Challenge 3. Heavy workload, limited support. Nurses often work long hours with minimal breaks, handling multiple patients simultaneously. One nurse shared, "I sometimes work 12-hour shifts without a proper break. The lack of support makes it even harder." Data shows that the nurse-to-patient ratio is often 1:10, far from ideal. Burnout rates are alarmingly high, with many nurses considering leaving the profession. Challenge 4. Continuing education gaps. Staying updated is crucial, but access to training and support, still a struggle. Many nurses face barriers such as limited resources, lack of time, and insufficient institutional support. Initiatives like online courses, workshops, and partnerships with educational institutions can bridge these gaps. Encouraging a culture of continuous learning and providing necessary resources are key steps forward. Challenge 5. Ethical dilemmas and communication. Balancing empathy with clinical decisions, especially in life and death situations, is tough. Nurses often lack support and face moral distress when their values conflict with job demands. For instance, deciding whether to continue aggressive treatment for a terminally ill patient can be heart-wrenching. Effective communication is crucial but difficult. Nurses must advocate for patients while adhering to hospital policies, making their role incredibly challenging. Case studies show that nurses often struggle with end-of-life care decisions and communicating bad news to families. The road ahead for NP professionalism in India is promising. With comprehensive policy changes, increased awareness, and robust support systems, we can see significant improvements. Policies should focus on better training programs, fair compensation, and clear career pathways. Awareness campaigns can highlight the critical role of NPs, while support systems must include mental health resources and professional development opportunities. Together, these steps can ensure that NP professionalism not only survives, but thrives. Professional nurse practitioners are the present. Let's give them the respect and rights they deserve. Support them by advocating for better working conditions, promoting continuous education, and recognizing their critical role in healthcare. Together, we can make a difference.